Thanks for staying with us here on Newsdesk. Well, the Ghana Health Service has confirmed cases of cholera in the Graeter Accra region. There have been some 10 cases so far, and we're finding out this morning how our authorities dealing with this, especially now that the rains are here and there's water shortage as well. Let's engage Florence Kuchi. She is Director of Public Health at the Accra Metropolitan Assembly. Thank you for your time here on Newsdesk. It's always a pleasure having you in the studio.
Thank you.
So let's start with an update with the current cases. I know you've been liaising with the Ghana Health Service. Where do we stand as we speak?
Okay, so cholera itself, it can be prevented, that is, if handled properly. But to start with, what at all is cholera? Everybody's hearing cholera. What is cholera? So cholera is a, what will I say? It is an infectious, deadly disease that can affect you suddenly by a bacteria known as Vibrio cholerae. And this bacteria is characterized by running, diarrhea, and we mostly describe that diarrhea as a rice watery stool with a pungent smell. Yes, like the...
It's how I picture it for... Oh, dear Lord.
Yes, with a pungent smell like the rotten egg. It goes with vomiting. You can either vomiting as well as defecating. Then
apologies to some of our audience who haven't eaten yet. But we need to talk about it.
You can also have, so when you are vomiting and you are running diarrhea, very watery diarrhea, it can lead to dehydration. And if you don't go to hospital early, you could lose your life. Then you can also have stomach pains and fever. So when you have all these characteristics, and then the toilet comes within more than, let me say, 1 hour non-stop, please start running to the hospital. It means you have ingested something. The mode of transmission is either direct or indirect. The direct is having contact into a person that has been infected with the Vibrio cholerae, and maybe the vomitors or the stool. And the person who have had contact with this person hasn't washed their hands properly, and they have eaten. And the other side is drinking contaminated water that has been contaminated with the bacteria, or eating contaminated food. This can happen when an infected person releases their stool and then maybe a fly go to perch on it. The fly is the cleanest insect we can find out. It doesn't like that. What the human being does, it will go and pick it and bring it back to you and come and pay you. So the infected person would would shit, and then the fly will go and perch on this and come and sit on your food, either the vegetables or whatever it is. Then when you eat, you are definitely going to get it. And the time frame between eating the infected food or the contaminated food is just an hour, from 1 hour through to 10 days. That one can get it. So having talked about all these things, now we know what the cholera is. So before one can prevent this, what are you going to do? You must follow all your hygiene protocols. After COVID, people have forgotten of their hygiene protocols. So as public health practitioners, as environmental officers, what we are doing is we are reactivating the hand washing system in all public places. We are enkindling education. We are mopping up all hotspot areas. We have some areas that you know that when one person happens to get it, is going to be an alarm. So we are doing all these things together, and we are not just doing it only as environmental officers. We are doing it with the Ghana Health Services, because in Ghana, we are now doing what we call the One Health system. The environmental health is there, the human health is there, and then the animal health is also there. Yes, so we are doing all these things together.
Just to educate
the public.
And
so
education is key, especially because the raining season is here again, and we have quite a number of issues with flood, sanitation, and what have not. But just confirm for me, the Ghana Health Service, as at our last count, gave us the number 10. Has the number increased so far?
As at now, that is what we are all counting on now. Yes, and we are not praying that it should increase. So far, they have activated the public health emergency teams in all the various assemblies. Then when you go to Ada, there's an intensive education going on, house to house, public places, ensuring that people eat hot food. During this season, eating cold food is not the best. We need to cover our food. We need to ensure that water we are drinking, if it is not, you are not sure of the source, please boil the water. Get some chlorine tablet and put it inside before you drink, just to be at the safer side.
Yes. Let's look at the areas that you're receiving reports of more cases. In the Graeter Accra region, where are your hotspots as we speak?
So, as at now, the issue is at the Ada enclave. It hasn't come down yet, but we just want to contain it at that place so that it doesn't come down. When you come to Accra Metropolitan Assembly, we have hotspots like the Abubuloshi Market, Old Fadama, Choko, Bubu, and you can see how these areas are. They are more or less city slums. And if care is not taken, one person is going to be like, boom. It's been a long that Ghana has experienced cholera. Since 2018 up till now, we haven't experienced cholera. And this is what we are now experiencing now. So it means something is wrong somewhere. We are polluting our water bodies. We are just throwing refuse indiscriminately. We don't care about how we handle ourselves. We have just left, everybody is doing anything. You go out, you greet more than 1,000 people, you come back, you don't even wash your hand, and then you are eating. You go to the market, you greet those 1,000 people, and then you use your hand to go and touch all the things that, the objects that the woman has displayed on the table. Meanwhile, at the end of the day, you are buying just one thing. So we are ensuring that we put a stop to all these things so that we can break the chain.
So it's more of a character problem that we're facing
as
a country, which we need to work on.
Sure.
But let's look at enforcement when it comes to sanitation breaches, people dumping refuse by the roadside. How is your effort so far to ensure that our streets are clean?
Yes, so it is upon some of these things that when you throw waste indiscriminately on the roadside and the environmental arrest you, we use what we can use the Criminal Offences Act, because by what you are doing, you can cause a life. You understand? You throw refuse into the drain. Then when it rains, there's flood. When flood comes, people can lose life. People can lose properties. And it can lead to economic loss to the state. It will not just happen to one person. One person being affected, it can generate to more than 2, 3, 4 people, because there are people that are depending on that person that is being affected. So sanitation issues is a collective effort. It is not a one-man business.
Indeed, it is a collective effort, and we've been speaking to the Director of Public Health at the Accra Metropolitan Assembly, Florence Kuchi, just giving us an update on some of the cases we have so far. You can share your thoughts with us on all our social media handles. If you have a question for her, she can answer. But it's more of a person problem, isn't it?
Sure. Cholera is a preventable disease. That is, if you live well, if you handle all your personal hygiene properly, because to prevent it, you need to ensure that you handle your sanitation issues properly. You register with the accredited waste collection company. You ensure that you don't dump your refuse indiscriminately. When you are drinking water, you drink water that is safe. You wash your hands always. Ensure that when you go out and you are coming, you wash your hands. Even when you are cooking, you wash your hands in between the cooking and even after the cooking. When you change the child diapers, you need to wash. It's just about hygiene and hygiene. When we go about our personal hygiene properly, cholera, we can curtail it.
After COVID-19, I can count the number of people around me that still own a sanitizer. So she's right. Well, that's how we wrap up the conversation here on Newsdesk. Up next is business news. Please stay tuned in.